Bactrocin mupirocin composition. Each gram of Bactrocin ointment 2% contains 20 mg mupirocin in a bland water-miscible ointment base. Mupirocin is a naturally occurring antibiotic. Pharmacology. Mupirocin is a naturally occurring antibiotic. It is an antibacterial agent produced by fermentation using the organism Pseudomonas fluorescens. It is active against a wide range of bacteria that are responsible for the majority of skin infections, e.g. Staphylococcus aureus including methicillin-resistant Staphylococcus aureus, MRSA, other Staphylococci and Streptococci. It is also active against certain gram-negative pathogens, like Escherichia coli and Haemophilus influenzae. Mupirocin inhibits bacterial protein synthesis by reversibly and specifically binding to bacterially soluble transfer RNA synthetase. Due to this unique mode of action, mupirocin demonstrates no in vitro cross-resistance with other classes of antimicrobial agents. Mupirocin is bactericidal at concentrations achieved by topical administration. However, the minimum bactericidal concentration, MBC, against relevant pathogens is generally 8-fold to 30-fold higher than an immune inhibitory concentration, MIC. Indication: Bactrocin ointment is indicated for the topical treatment of impetigoduto, Staphylococcus aureus and Streptococcus pyogenes. Dosage and administration: as small amount of Bactrocin ointment should be applied to the affected area 3 times daily. Theory treated may be covered with gauze dressing if desired. Patients not showing a clinical response within 3 to 5 days should be re-evaluated. Contraindication: this drug is contraindicated in individuals with a history of sensitivity reactions to any of its components. Precaution: Bactrocin ointment is not for ophthalmic or intranasal. If reaction suggesting sensitivity or chemical irritation should occur with choice of Bactrocin ointment, treatment should be discontinued and appropriate alternative therapy for the infection instituted. As with other antibacterial products, prolonged use may result in overgrowth of non-susceptible organisms, including fungi. When Bactrocin is used the face care should be can't avoid these. Polyethylene glycol can be absorbed from open wounds and damaged skin and is secreted by the kidneys. In common with other polyethylene glycol-based ointments, Bactrocin ointment should not be used in conditions where absorption of large quantities of polyethylene glycol is possible, especially if there is evidence of moderate or severe renal impairment. Drug interaction: the effect of the concurrent application of Bactrocin into their drug production has not been studied. Use in pregnancy: the drug is classified in pregnancy category, because animal studies are not always predictive of human response. This drug should be used during pregnancy only if clearly needed. Use in lactation: it is not known whether this drug is excreted in human milk. Because many drugs are excreted in human milk, caution should be exercised when Bactrocin is administered to nursing women. Pediatric use: the safety and effectiveness of Bactrocin have been established in the range of 2 months to 16 years. Use of the ointment in the SIGA groups is supported by evidence from adequate and well-controlled studies of mupirocin in impetigo and pediatric patients. Adverse effects: the following local adverse reactions have been reported in connection with use of mupirocin ointment: burning, stinging, or